the Littleton Board of Health Wednesday, October 13th, 2021 virtual Zoom meeting. We'll start at 7 o'clock with a public hearing regarding 12 Shattuck Street, to review the modified housing order. So tenants or
I believe Karen Amy Rose is the owner.
Yep, Rena and I are on the same Zoom.
Okay. All right. I just got a checklist for this.
Yes, I wasn't sure if Mr. Gareffi would be on the call, but I sent to you guys and to him the original violation list that he had provided us with the things that we have done crossed off, and the remaining outstanding items with the timeline of when they would be addressed.
Okay. And then he does have some notes too, so.
Okay. I wasn't aware of his notes, but thank you.
Yep, that's great. Our understanding is the tenant is leaving Friday the 15th. They're packing and moving, so if all goes well, it will be unoccupied after that, so it'll be easier to do the work.
Okay. And according to the checklist, there's a few things that are starting on the 15th too. So windows, etc. All right. Does anybody want to read Jim's meeting notes at all for 12 Shattuck?
I'll be happy to read Jim's notes.
Great. Thanks, Mike.
This is from James Griffey in regard to 12 Shattuck Street housing order continued. The office has received a timeline for the remaining work, and I tried to get a re-inspection before the meeting, but it is scheduled for October 14th at 1 p.m. The owner sent the board a list of remaining violations and the action to get them corrected, but no timeline for completion. The email also indicated the current tenants are leaving the unit on October 15th and that the owners did not intend to rent the unit again until the violations were corrected and the unit re-inspected. In parentheses, he states the second floor tenants have left the building, and I discussed the importance with the owner of not renting this unit until the violations were corrected and the unit re-inspected. If this unit becomes vacant and stays vacant until the corrections are made and the unit re-inspected, the Board of Health has latitude on time schedules for correcting the noted violations. But the most important thing for the protection of future tenants is to explain to the owners the units, first and second floors, can't be reoccupied until the violations are corrected and the units re-inspected by the Board of Health. If the tenants aren't leaving, the Board of Health should require a formal timeline for the correction.
And Ms. Rose, you said that that is the plan, that they're leaving on the 15th.
Yes.
Okay. All right. Does anybody have
Madam
any
Chair,
comments?
in red on that checklist, they did provide a timeline for correction.
Right.
On behalf of Jim's notes, I just want to repeat, if the units become vacant and stays vacant until the corrections are made and the unit re-inspected, the Board of Health has latitude on time schedules for correcting the noted violations.
So there's no plan on renting these units until the re-inspection.
No, we'll call for inspections before we rent anything. There's a lot to do before then.
All right, so do we have time? According to Jim, I don't mean to keep at this, but Jim is indicating we have latitude for the time schedule for correcting the violations. So in other words, it's not a wide open, indefinite period of time. We have latitude to set a reasonable time period for the correction of the violations.
Yeah, I think the issue might be that we put all the start dates, but the contractors can't say the exact date it will be complete. So maybe that's what he meant by there's no.
Right.
We don't
Mike,
have
if you-
The exact dates on that.
Yeah, the violation list has 6 to 8 weeks, roughly timeline, late fall for a contractor to come in. So I guess you probably Ms. Rose, you probably want to get this corrected as soon as possible so that you can rent it out again too.
Yes.
All right. Did you want to make them speed up the, I don't know if they can speed up any more than they have or can, Mike, because
No,
of the
I'm
availability of contractors.
No, I think the only thing, my suggestion, and I think other board members should weigh in on this, and to be reasonable, is if the contractors have given a date, we all know that that's, hope and a prayer in a lot of cases, especially now. We could certainly indicate to them that extend that date slightly and then continue our, shall we say, our surveillance of this effort and have them come back and report what the progress is. In other words, give them extra time, given the circumstances, for the contractor to complete the work, but come back at that point and report where are they. So in other words, there's no problem in extending the time or setting a time. I'm just suggesting that this can't go on forever, because sooner or later the tenants will decide, oh, we're not coming back or whatever, which is their prerogative. But the idea is that we can't have this sitting open indefinitely. That's the implication I'm getting from Jim's report.
Right. Are the tenants left for good, or are they leaving?
No, yeah, they are moved out. Yeah, there's no one. Upstairs is vacant. It's not occupied, and downstairs will be unoccupied after Friday. So there are no tenants.
Okay, and they're not waiting to come back after the work is done.
No, they're done.
Anybody else have comments or questions?
I do. Now, if the apartment is empty and nobody's there until the job is done, you have to realize the contractor, sometimes they say, I cannot be there for another month or two. So you cannot, penalize the individual just because she tried. If the contractor that she has now will put it to an extent time, she should say, I'll get somebody else to come because I needed to do it earlier because the Board of Health gave me so much time. But as long as the apartment is empty, you cannot penalize the owner. You got to be patient until somebody will come and fix it. And that's my experience, because I wanted to have my septic system empty and they told me, oh, I'll be there in December. I can't wait for December, so I get somebody else. So you have to be cautious before you make a judgment. I understand what Mike read. I appreciate it. I appreciate what Jim says. The question is, you have to make sure that the lady has the time to have another contract if the contract is going to give her too much time. Thank you.
No one on this board has suggested penalizing the owner. I haven't seen anything in the notes or in our comments here. Absolutely nothing.
Well,
All I'm saying is the implication from Jim's remarks here is simply that this can't be, these were violations. This can't be occupied. All
Right.
I'm saying is they have to be re-inspected, and Jim's got a full plate. And all I'm asking is that, all he seems to be asking is give the owner a reasonable period of time and give us a progress report. And if the contractor says I can be in 2 weeks, whatever it said, we can extend that time to maybe 3 weeks. Come and tell us what's going on.
Thank you.
That's all I said.
Madam
Sometimes.
Chair,
Kevin? Go ahead, Kevin.
based on their checklist, it seems like everything will be completed within 2 months. Is that correct
It looks
assumption?
like the bedroom left Shattuck Street exit entrance, the rough timeline of late fall. So
That is the biggest open question, because they're going to need to open the floor and diagnose the issue. And if we have to replace, for example, all the floor joists, that may take a few months. We can certainly commit. It's going to be unoccupied until it's full. So I don't know if you want to specify a date and we'll come and give an update. You know, we'll update whatever's done. Or we could just,
I propose
No,
January
when we
January
want-
12th, maybe
Yeah.
coming back and just giving us an update.
That sounds,
sure thing. I mean, yeah. And we can always update as things happen. We'll let Jim know, of course.
That sounds good. The only thing. Okay. Janet, can we do that? Have a follow-up for our January 12th meeting?
Yes.
Put them on the agenda for just a follow-up.
Mhm.
No penalties, Gino, just, it's been an issue that's come up before us, so we just want to make sure that it's heading in the right direction.
Thank you.
All right, Dan, did you have any questions or comments at all?
I didn't. I took the Jim's leeway comment really basically if the building is empty, while we obviously want the corrections made, it's not time critical as if we had residents there who were living in substandard housing. So I think
Yeah.
that's how I read Jim's notes, was that we had the leeway to say, if you need some more time, take some more time. However, units must remain empty until they've been inspected and cleared by the health
Good.
agent on the board.
Okay, great.
Thank you.
All right. So
Thank
we'll
you
see-
so much.
Good luck. We'll see you again January 12th,
Thank you.
thank you.
just for an update.
Yes, thank you.
Good luck.
Thank
Good
you.
luck.
Thanks.
Great. 7:10. The discussion of a COVID update with Katrina.
She's on her way.
Thank you.
Hi,
Hi, Katrina.
I'm all in, I think. Okay. All right, so you ready for, I disappeared for a minute. So you guys ready for me?
Yes.
Okay, great.
Always ready.
Always ready for me. I'm not always ready for me. All right. Let's see. I'm assuming you can see the first slide. Had an update, so everything looks different. Okay. So let's just dive right in. So here is the first page of the DPH dashboard, not the second page technically of the DPH dashboard. And things I have to say, look on a statewide level, very stable over the last 2-week period. The 7-day, so just keep in mind that we just had a holiday weekend. The number of tests that were conducted statewide were depressed. I looked back and we have 4 days of very low testing rates, which given the holiday, that makes sense. So I'm expecting more tests to start rolling in at the end of this week, and that might change some of these numbers a little bit. But the 7-day average of cases is about 1,000 per day. Test positivity is around 2%. Again, that's a stable number. The average 7-day average of hospitalizations is actually down to about 550 per day. And when I looked into the bed occupancy, it's improved a little bit. So there's 88% of all hospital beds are occupied and 80% of ICU beds are occupied. So there's a little bit of buffer on the top in case something happens. And deaths are now averaging about 11 per day. This number has ticked up over the month. We were doing like 5, 6, and we've kind of creeped up. And if you think of that over a week, that's 70 deaths a week. So we're still like that to be lower if we can get that lower. All right. So then if we look at the state and the county, Middlesex County for the CDC community transmission rates, Middlesex County is actually now classified as a substantial community transmission area, which is now colored orange. So we've come down a little bit over the last 2-week period since I was last here. So the current rate as of today's data is around 96 per 100,000. So it's right at the very top of that category. And the test positivity is still stable at about 1%. So Middlesex County has improved a little bit, which is great to see. And then this is the COVID case rate by age group. This comes out every Thursday. So this data is from last Thursday's DPH report. And I've covered the last 6 weeks of time. So at this point, or as of last Thursday, ages 5 to 9 and 10 to 14 had the highest 2-week incidence rates of all age groups. But those were pretty, they were going up for a while, but last week they were stable, even declined slightly. So at this point, they are a little higher than everywhere else. And we're going to see what happens tomorrow when the next bracket, the next data gets updated. It's important to remember that those are unvaccinated age groups. Those are not currently eligible for vaccination, at least until age 12. So those are groups to keep an eye on, especially since they're school age kids with a lot of contacts. The other age groups are actually largely stabilized or have declined, specifically ages 20 to 29, 15 to 19, and 30 to 39, which were the concerning groups a few weeks ago at the beginning of September. They have actually started to go the other way, which is really great to see. So hopefully these declining trends continue, and that will help bring everyone else back down. And then if we get into some local data, Littleton's looking a little different than the state and the county. And even our surrounding area. So Littleton, as of last week, this is data through October 2nd for the 2-week period. We had 36 cases reported on last Thursday's DPH report. Jim did a quick sneak peek into the Maven database, and we expect to see about 49 cases reported tomorrow, which is yet another week of increase if that is true. So we will confirm that tomorrow. This is actually very consistent with what we were seeing in the school case reports last week. So I will go into that when we get to the school data. Just the methods for how we aggregate for different areas. So we can, because Littleton's so small, we need to go a little bit broader to get some stable numbers to work with and to see what's happening trend-wise. So remember the graph on the left is the average daily incidence rate per 100,000 people. If we do it that way, we can compare different areas. So this is for this last date here is for the last 2-week period, which ended October 2nd. And as you can see, the Littleton had a sharp increase between the prior week and last week. So our average daily incidence rate is now, with those 36 cases, is now 26.4 per 100,000. That is an increase from about 20 per 100,000 in the 2 reporting periods prior. So over a month's time, we've increased. The state, the county, and the surrounding areas, so like getting closer to us, but not quite to our border towns, those are actually stable or even lower. Remember, Middlesex County went down a little bit. So the places beyond our borders are actually faring a little bit better than Littleton has. But our border communities, those towns that literally touch our border, also ticked up a little bit. I have to say this is largely driven by Littleton and Westford. So as of last week, so we will see what happens tomorrow when this data comes out again. Test positivity across the state remains below 5%, is actually below 3%. Again, test positivity is the number of positive tests over the total number of tests conducted, and multiple people get tested more than one time. So this is not a good one. Don't think of this as individuals. This is a good indicator of, are we doing enough testing to really identify cases quickly, get them into the test, trace, and isolate system so that we prevent spread. Because everywhere in Massachusetts is under that we look at anyway, is under 5%. It's under 3%. We are doing a good job in the number of tests. That is one of the things our state does very well. So thinking ahead for tomorrow, when we see the data, we have 49 cases. We expect to see the rates increase. Tomorrow, I'm expecting the test positivity to continue to increase a little bit, but we'll see what the other areas around us look like. But when Jim's sneak peek for the whole Neshoba associated Board of Health catchment area, all of those, when you look at that area as a whole, like all those towns totaled up, there was an increase. So I'm assuming there's a slight increase happening in our area. So then if we look at convert our numbers to the CDC community transmission indicator, which is a 7-day incidence rate, total new cases over a 7-day period per 100,000 people, we can see that the state as a whole is continuing to be in the high transmission category, but it had declined last week. Middlesex County just tipped into the substantial community transmission area. So that's a good sign. We want that to go down, hopefully into yellow. But unfortunately, Littleton went the exact opposite direction as the county and the state. So we are still classified as a high community transmission area. Okay, so here's the state. This is the school data. So remember that the school sends out an email for every case that is reported to them or shows up in their testing system. And then we figure out which schools they are associated with. We get to learn that as parents. So the district to date has had 26 cases. If you look over time, these are all the weeks since the start of school. So from September 2nd all the way to this morning, actually, you can see that we had a couple of weeks with very low cases, and we had a 3, a 4, an 8, and a 9. And the 9 is actually just 2 days this week. So Tuesday, Wednesday. So we have a few more days to fill in on this one if there are any more cases. So this jump between 4 and then 8 over that, we just looked at that 2-week period with 49 cases in Littleton. 12 of those cases were associated with a school, assuming that they're residents of Littleton. So a good quarter, little under a quarter of all cases came from the school population, which is a little more than the population for those age groups. So they're trending a little higher than the rest of the community. Of note is the 8 cases reported this week. 8 of the 9 cases reported this week so far. 8 of them have been at Shaker Lane. There was a cluster there. Hopefully we'll get more details tomorrow at the school committee meeting. But between I have to say, listening to how these cases were identified and captured quickly, it seems like that we had a positive pool at Russell Street last week, and we caught the case and then started test to stay. So that system worked the way we wanted it to work. The system is working to mitigate, identify cases quickly, and then figure out who the contacts are. And it sounds like this system also worked well. The school learned about the cases, figured out where they were, they did the contact tracing, and then test to stay this morning identified 4 more cases that were among the close contacts. So the system for mitigation seems to be doing what we want it to do, which is a good thing. We want our mitigations to work. Unfortunately, that means that we have potential school transmission that we need to learn about tomorrow. And I wish Jim was here, or we could report back after the school committee meeting tomorrow. Interestingly, so Shaker Lane, all students, and Russell Street, all students, they are not eligible to be vaccinated. The cases are pretty low, except for these 8. I mean, they're reasonable to expect, except for this cluster. Middle school, you have just 6th graders who are not eligible for vaccinations, but 7th and 8th graders are. So there's 5 there. The high school's actually had 10 cases to date, so 10 out of 26. I do expect high schoolers to just have more exposure opportunity. They are older, they have more social contacts. The way they interact with their peers would just give them more contacts that it might be transmission. So this is another, but they're highly, well, I don't know how many of them are vaccinated and have reported it to the school, but those age groups in town are highly vaccinated. So we're going to have to get an update from the school tomorrow to see how that's going. Okay, so speaking of vaccinations, Littleton has done a great job with vaccinations to date. At this point, as of this data is of last Thursday, 74.8% of all of Littleton residents are fully vaccinated, and 5.7% are partially vaccinated. So when you add that together, we are just over 80% at least 1 dose. So we're well on our way to that 80% threshold, assuming every partially vaccinated person finishes. There's still about 600 residents, according to this data, who are eligible but have not yet been vaccinated. So there are some unvaccinated eligible people that hopefully some outreach and sideline chats or something could start to whittle away at. The majority of individuals who are not vaccinated in that group are actually aged, according to the data, aged 50 to 64, or the older parent into retiree age group. So that is a group I'm not entirely sure how to reach out to. So if anyone has outreach ideas, that would be great. But the COVID working group keeps trying to throw out ideas just to see what we can do to whittle this down. And it has worked in the recent weeks. So we'd hope to keep it going. A couple things just to keep in mind, the FDA will be reviewing Pfizer data for ages 5 to 11 at the end of October. The CDC will follow up at the beginning of November. So in the next few weeks, like the next month, hopefully we will have a vaccine for that 5 to 11 age group, that age group that are currently having higher case rates than the other age groups in our state. So hopefully they can join the vaccinated crew, and that will help with transmission and preventing disease, especially for those who have risk factors, or just anyone. No one wants long COVID for their kid too. That's a lot of years to have to deal with a health issue. So hopefully that emergency use authorization will come through in the next few weeks. Okay. So as I start to wrap up tonight and move into the public health messaging, I just really want to come back to our local case data. So Littleton is currently experiencing a period of high transmission. And as I reported earlier, we expect to see the 49 cases reported tomorrow. And to put that in context, outside of Thanksgiving and after Christmas, this is our highest peak that we have had experienced since last August when I started doing these presentations. So we're having a period of transmission that we need to be concerned about. The school data is actually more recent than this town level data. And when I look at that, 17 out of the 26 school cases, so 65% have been reported in the last week and a half. So a large proportion of our cases in the schools are right, like the most current data we have. And given that, that's another indicator that the town counts might remain elevated in next week's report. So given that we're having this high period of high community transmission, I think it's important that everyone just take precautions right now at this point. Do what you can to help prevent spread, to make our schools safer, to keep our businesses open, just to, if we can, given our vaccination rates, if we can squash some transmission right now, we should be able to return back down to meet where the rest of the county is relatively quickly. But it's going to take some community commitment to do that and make that happen. So it's been a while since I've reviewed in a little detail some public health messaging, and I just want to nail it tonight, given that we're in a high community transmission period of time. So the COVID is airborne. The route of transmission is primarily through the air that we breathe. People can get infected mainly through inhalation of respiratory droplets or aerosols, fine aerosols, mostly in indoor areas where it concentrates. So SARS-CoV-2 can remain suspended in the air for long periods of time. So even if you are not physically near someone, if someone had been in that room for a period of time and enough particles have concentrated, you may end up walking into air that is actually has infectious virus in it. The risk of infection varies according to the amount of virus that a person is exposed to and inhales. And that can happen when you're in an enclosed or inadequately ventilated space where concentration of virus builds up. When there's more particles that are exhaled, there's going to be more that are inhaled too, and also with prolonged exposure. So the longer that you're in that space, the more likely you are to get infected. But we know what to do. These are the same layers of mitigation that we have used for over a year now to help slow the spread. So we know what to do. We just need to do them. So to be a little more specific, if you want to look for places with good ventilation, so if you're meeting a friend, if you have family members over, anything you can do to help increase the outdoor air in is a great idea to help dilute virus particles. So you can improve indoor air by opening the windows, running an exhaust fan, or using a portable air cleaner. And then whenever possible, meet people outdoors. I know we're getting into colder seasons, but it's still pretty lovely this week. So when the weather's great, go outside because the virus particles dilute very quickly outside. And then it is time to upgrade your mask. So there was a recent randomized trial that was published about the community benefit of masking, looking at randomized towns in Bangladesh. And the results indicated that towns that were randomized to use surgical masks had lower rates of COVID spread than towns that were not randomized to use any masks. And surgical masks came out more superior to cloth masks in the same study. So there have been many studies over the last year that have shown that improving the fit and filtration of your mask can better protect you from inhaling any virus that's in the air, but also limits the number of particles that you exhale into a given environment. So if you are infected and just don't know it yet, you'll be breathing fewer particles into the air for your peers to inhale. And masks are no longer in short supply. They're very easy to get on every store shelf or order online. So it's really time to upgrade your mask for a better quality filtration and tighter fit on your face. And the CDC's Prevent Getting Sick mask fit and filtration page has a lot of good advice and demonstrations of how to improve the quality and fit of your mask. So the other thing that another tool we have available, we did not have last year, is rapid antigen test that you can buy over the counter. So Delta is contagious earlier than the prior COVID variants. And so starting around 2 to 3, you're going to start, if you are contagious, that's when you'll start being contagious to others after your exposure. So early detection of infection is key to preventing spread. So this can be like, there's the PCR test that you can go to your doctor, get swabbed, they send it off to a lab. You have to wait a day to 2 to get the results. In the meantime, you can do a rapid antigen test and know in 15 minutes whether I am contagious right now. So these tests are actually designed to say, am I infected and contagious? So they will light up for a shorter period of time, but that is the period of time that you will potentially spread to others. So these are actually the kinds of tests that are being used in the Test to Stay program and the symptomatic testing program in our schools. And they have seen, as we saw, as I mentioned earlier, they seem to be working the way they are intended to use for that testing protocol. And this would actually be a really good tool to use going into the holidays if you're planning to gather with friends and relatives, especially friends and relatives who have health issues. Having everyone take a swab right before your gathering would just make sure that someone in there is not contagious on the day of your gathering. However, these can be hard to find. So if you want to do that, you should order now so that you have them for Thanksgiving and Christmas or any of the holidays over this next few weeks, months. I actually have a box in my medicine cabinet. My son had a close contact. It was great to have that to use for our family. It was very useful. So, and when in doubt, please test. And then the most important tool, I'm just going to come back to it, is vaccination. These vaccines that we have access to are highly effective at protecting you against severe disease, hospitalization, and death. Vaccinated people are much less likely to get infected. And if you're not infected, you can't spread COVID. Not only are these vaccines highly protective, but once fully vaccinated, you have different quarantine requirements, actually lack thereof of quarantine requirements. So that is a nice thing to deal with, especially where we have high transmission. So you might have more contacts that you would have to quarantine for if you were unvaccinated. Immunocompromised people should get their 3rd dose. That's not a booster. That is part of their series. So go and get your 3rd dose if you have an immunocompromised situation. The CDC also released an urgent health advisory strongly recommending COVID vaccines for people who are pregnant, recently pregnant, or who are trying to become pregnant to prevent serious illness, death, and adverse pregnancy outcomes like preterm birth and admission to the ICU. So if you are pregnant, please talk to your doctor about getting vaccinated. And there is a Pfizer, Moderna, and J&J. We have 3 different vaccines. They each have different benefits, different safety profiles. They're all safe, but they have slightly different, profiles is the right word, with them. So if you haven't been vaccinated and you're just unsure, this is the perfect conversation to have with your doctor. Who knows your health history and your risk factors. So please talk to your doctor if you have yet to be vaccinated to talk about which vaccine would be appropriate for you. Boosters, Pfizer's boosters have been approved for people aged 65 or older, or people aged 50 to 64 with underlying medical conditions. They also recommend that residents of long-term care settings, people aged 18 to 49 with underlying medical conditions, or people who have increased risk for COVID exposure due to their job, they may get a booster. It's not required. again, if you have questions, talk to your doctor, a Pfizer booster. The FDA will be reviewing the Moderna and the J&J booster data later this week, as well as looking at data about mixing and matching the vaccines. So more information to come over the next couple of days. And like I said, the FDA and CDC will be reviewing the data for the lower dose Pfizer vaccine for children aged 5 to 11 at the end of this next month and the beginning of November. So if the review process goes well, I know Littleton has planned a vaccination clinic for kids aged 5 to 11 in November right here in town to help us get access to vaccines, which is amazing. And thank our town administrator for that and his office. So please, before that happens, if you have questions about these vaccines, reach out to your pediatrician ahead of time so that you don't miss this opportunity if this is something you want to take advantage of. But again, I just want to reiterate as I close out this presentation that vaccines are our best tool to protect ourselves and also those around us and those in our household. And getting vaccinated before the holidays would also be a great way to protect your family if you're planning to gather with them. And you need time to get fully vaccinated, so start now.
Yeah. Great, Katrina. I talked to Jim earlier today, and he has another meeting with another town, but one of the other layers that we can recommend for the younger kids that obviously the numbers are a little bit higher at Shaker Lane, but carpooling and sleepovers are a great place to have transmission. So that might be something that we want to recommend limiting to. So.
And that was a problem last year. So I'm not surprised it continues to be a problem this year.
Yeah. So the Vax clinic for the littles that Anthony has scheduled for November, we're still up in the air because we still don't know whether or not the younger kids can get vaccinated or when that's going to happen.
So we talked on Monday at the working group. Did you get? I know you missed it, but there was an update. So they've kept there's like a November 8th date, a November 29th date. They've actually added a third date. So if the first date doesn't work out because of the timing of the EUA, then we can just use the next two dates. And if it does work out, we are actually thinking of keeping the 3 dates so that we give people options of when to register to get vaccinated.
Right. And do you have any idea about, Anthony said that there were 60 plus people that were vaccinated at the Vax bus on October 1st.
Give me a second.
So are they Littleton residents? Did that number change much?
So I am unsure if that number didn't change a lot this week. But I think that's because it was reported to me there were 68 or 69 people who were at the Vax bus, which was more doses than were given last time. But 60 of them were boosters. So people who needed their booster got their booster, that's also great. Like that's not always easy to find. So it's great that those individuals had access to them. There were, I think, 9 people who got either their first dose of Pfizer or their J&J. So they're fully vaccinated. So there was some movement in the first timer category. But most of them were boosters.
But we're not sure if they're Littleton residents.
We do not know if they're Littleton residents.
Okay. All right.
Or I don't know. Maybe someone else does, but I don't think that was disclosed.
We're running a little bit late, but Anthony's going to be here and Joe, we're going to be here. Maybe they have that. You might already know that from the Monday meeting or Tuesday meeting, right?
Yes.
Go ahead, Mike.
Thank you. I just want to get something out of the data that you went over when you posted the state date on local cases, and you indicated total vaccine, partial vaccine by age group. I believe you had them up. Could you just bring that up? Because there's something that popped up in another conversation that I've had ongoing with people in the state. Could you just, if you wouldn't mind?
This slide?
Yeah, that's the one. Yeah. What I'm concerned about here is I know it's a tough one, and everyone I talk to is sort of scratching their heads what to do. But what I'm talking about is something that sounds very trivial, and that is, what is the population really of Littleton? I mean, I know it sounds silly, but Littleton's so small it makes a difference. Well, it turns out that, for what it's worth, that the U.S. Census, recently, quote, completed but not yet totally certified, is being used to decide something very important called redistricting. So if you're going to do that, let's use that number. And that number, I think, is 10,041. That's the total population here in Littleton. It wouldn't surprise me that we've grown from the 9,000 we were before. And I believe what it does is it changes what we'll call our vaccination rate. So what I'm looking for here is, here we are, the whole town's working very hard to, shall we say, keep our counts down, and we are seeing an increase. So apparently leaving out people who are vaccinated, and let's say it's somewhere between 70 to 75% of our population is fully vaccinated, it leaves a sizable number. I don't know what exactly that number is, but I don't believe it's, shall we say, 597 eligibles.
So I totally agree with you, Mike.
I'm lost. And what worries me is that the eligibles who are not vaccinated are meat for the virus. And if you're not vaccinated, you're going to get it. You're part of the problem. Yep.
Yes, this denominator has been in question since the beginning of the pandemic. I'm going to just drop this so I can talk to Glenn. So the denominator that the DPH uses is the UMass what is it?
UMass Medical?
No, Donahue.
No.
UMass Donahue.
No,
estimate.
Donahue switched recently. I saw that's where I got this number. Okay.
Things are moving, but UMass Donahue is what this 9756 number is. The state updates, the DPH last November 1st, it was the first week of November, changed. They were using the 2018 denominator for all of their rates. Then November 2019, they switched to the 2019 denominator. I anticipate over the next month, they're going to change our denominator again based on the new estimate, much like you just mentioned. Because I think this has kept coming up that we have more people. But conversely, I went to town hall and asked for our census number, and it was one off from the 9756 for the last one. So the last town level census. So something's different. This is the data I have and the denominator I have. So that is what I'm reporting, because I don't have the age groups, and I'm not playing that game of this is one, using a different denominator and pretending I know what's happening. This is the data that they've matched together because there's a reason for the numerator and the denominator. And so I'm going to trust it until they say, okay, wait, we have an updated one with the new census numbers.
Okay. Everything would be fine, except, all right, except that if we do have a high rate of vaccination and we're seeing cases increasing, that means the folks who are getting sick, testing positive, consisting of eligible and ineligible individuals. Okay, somewhere the virus is, shall we say, has found enough people. And statistically speaking, if you run the numbers, if it's 1,000, okay, you're going to get these kind of numbers of 49 and whatever if you have community spread. And I think both of us know that. Mm-hmm. If you have a number like 596, we wouldn't be seeing this number.
So that 597 is just eligible. You still have 1,300 people. So we still have like 2,000 people, even in these numbers, that have not been vaccinated. But I agree with you. And you have to think that if we have more residents here, that doesn't mean that they're not vaccinated. It's just that the numbers aren't lining up perfectly. And this is how there's always limitations to numbers in epidemiology. You have to understand them.
Yeah, but in the real world, this is biting us. So what I'm trying to get at here is that, for example, one of the groups that is most threatened, that has to be most careful, is the other age group at the other end of the spectrum. Now, there's the people who are 65 and 70 or older. They're particularly vulnerable, and they should be getting boosters at the first opportunity that they come available. They should not delay. In fact, I hope that our board expresses a strong recommendation that all the seniors, as defined by the CDC, seek immediate booster.
I agree.
And if they haven't been vaccinated, please get vaccinated, because the Delta virus is nothing to be trifled with. It even defeated one of the other variants that had special properties I'm glad we're not going to see.
Yeah, those highly transmissible variants are going to be tough. Tough to beat.
Yep.
It runs fast.
Does anybody else have any questions for Katrina or comments?
Thank you as always.
Yep, thank you.
There were some comments there were some questions in the audience, if you're ready to take those, Lisa.
Sure.
Okay.
You'll have 2 minutes and you can raise your hands and state your name and address, and you'll have 2 minutes to comment or ask your questions.
Okay, the first person is Sandra Santora.
Hi, everybody. I'm Sandra Santora. I have 2 kids, 3 and 5, that go to Shaker Lane, and they're part of this outbreak. And I just wanted to shed some light on it, some of my concerns. One is that the entire class was identified as close contacts, and I don't understand what that means. I know I've read the definitions that have come out, but I don't understand how an entire class can be a close contact. And that Monday evening, we were told the class would be closed the next day, but it wasn't until a full day later that we were told our kids were close contacts. And my kids haven't even been in school since last Thursday. Another thing is that my son had the rapid test positive this morning, and my daughter didn't even get tested because my son's already came back positive. So that just kind of speaks to the numbers being inaccurate. And another thing is my daughter finished leukemia treatment in April. So I was really counting on the school to keep her safe. And I'm really disappointed in that, and felt I needed to speak up, even though I'm shaking right now. I've done everything I could to keep her safe, and it just feels like a big failure to me, and I don't know who's responsible for. I don't know what happened in the class, and I'm not getting answers. So I just wanted to comment on that. Thank you.
Oh, sorry to hear that, Sandra. I hope she is not one that gets severe symptoms. So, does anybody have any? Oh, sorry. Any comments or questions? The close contact question. Oh, sorry.
I'm not an authority on it, but I believe that the definition of close contact is defined both by the public health in the state, the CDC, and also by DESI. And it's not inconceivable that in a class of children that young, that they all, as it were, by definition, are in close contact, probably more than several feet away from each other for long periods of time. That's not who they are. It's human nature they get. So I believe the school has made every effort, but I believe here in this case, it sounds to me very much that the virus has the able to be so easily transmitted that everything that we're doing depends heavily on something working perfectly 24/7, 100% of the time. There's more of the virus than there are of us, our ability to defeat. So there, in looking for responsibility, it has more to do, I think, with the fact that the virus is being readily transmitted by people who are totally innocent of the fact that they're transmitting.
Thanks,
Sorry, can I just speak to the definitions? I know they are incredibly confusing. My son was also identified as a Russell Street close contact, and he had to do test to stay, but there were other close contacts in his classroom that didn't. There's the close contact definition remains the same that the state has used, which is that anyone who's within 6 feet for 15 minutes or more over the 24-hour period is considered a close contact. That is the Board of Health close contact definition, if you will. DESI uses a special which definition, which they came in conjunction with Mass DPH for classroom close contacts. And those are individuals who were at least 3 feet away from each other and both masked in a classroom situation. Those are classroom close contacts. And then anyone who's less than 3 feet or in an unmasked situation like lunch would, who are close together, would then be the less than 3 feet close contact, and those would be test to stay or quarantine requirements. So there are 3 different levels. I have to say that my experience talking to the nurses from Russell Street and Lynn Snow have been really, you should reach out to them because they're very knowledgeable about these different classifications and how it works. But I have to say that when you think of a Shaker Lane classroom, those kids are constantly on the move. They're going to be interacting. They're going to be close. That's just the nature of a preschool to second grade student. So yeah, it doesn't surprise me with 8 cases within that school, a number of them being in the same classroom, that by in the end, everyone is a close contact in that classroom, no matter how much they try really hard to make sure that doesn't happen. If this is I'm really sorry that this has happened to your family. I know this is stressful.
Thank you, Katrina. Janet, was there anybody else?
I'm not sure I'm pronouncing it correctly. Ina Landsman, you can speak.
Hi, Ina Landsman from 27 Lawrence Street. I'm calling in to ask if the BOH modify its mask mandate to include the schools. Now, I think the school committee is doing a phenomenal job, but they do not have the expertise that you have in public health. They are not experts in this area. And I think, as Katrina made clear, we're in the middle of an uptick in cases. And sometime next month, we expect that most of our kids will be able to get vaccinated. Right now, they can't. So I'm asking you to consider modifying the mandate so that you can bring your expertise to bear on this issue and consider issues like community transmission and percent testing, for example. And then based on your expertise, decide what should happen in terms of masking in the schools. Thank you.
Okay, thank you. I think we're going to be talking to, I know Justin's here, I think. And I think I talked to Matt last night that they were talking about maybe doing a joint meeting, but I think it was, and it was about the masking. So I don't think we can make that decision tonight, but we should definitely meet with school committee. I don't know if Justin wants to comment on that at all, if he's even here.
I don't see him, but I don't have a hand up for him if he is here and I'm missing him.
Yep. All right. Well, I know we'll take that into under advisement for sure.
Your next caller is Matthew Ridge. Matthew, you can state your name and address, please. You have to unmute.
Hello, Matthew Ridge, 325 Great Road. I just have one issue here is that I know the class that actually was affected over at Shaker Lane. But the real issue I'm having is where does it say that the vaccines have been accepted for anything but emergency purposes? I'm sorry, but as far as I know, in the federal side, they have not yet. It has not been approved. It's just been approved for emergency uses. And as far as I could tell, Littleton is not under emergency situations. We do not have a breakout. We do not have 5%, 10%, 15% of our population getting infected. We need to be careful about what we put out there as fact, because right now we are finding out that we're spreading misinformation when we're not meant to. And I want to make sure that that's being covered, because we need to be careful, because an emergency is an emergency, and we're treating this far greater than I believe we should be. Thank you.
Go ahead, Mike.
I just want to comment. Thank you, Matthew, for your concern. I just need to just advise you that the Pfizer vaccine has gotten full FDA approval. And that happened several weeks ago. Number two, the number of people who've taken both the Moderna and the Pfizer vaccine, as well as to a lesser extent the Johnson & Johnson vaccine, the numbers far exceed anything that could be accomplished in a clinical trial, and on the basis of the results obtained across every state where it has been used, have shown it to be very effective. The emergency denomination was put on those things originally to speed, not to cut short the process or to play a bureaucratic game of approval or disapproval, but in an emergency, which is what we are technically, whether we want it or not, in the real world, we're still in one in this country. We still have a pandemic in this country. So the Moderna vaccine is on its way for full approval. I believe the issue of full approval for those vaccines for initial doses is basically an academic one, not necessarily a scientific or medical or clinical one. So there's been no misinformation. These are safe, effective. In fact, I would argue they are the most effective thing we've got in our in our lives at the moment to prevent this disease from spreading, from causing disability, long and short term, for thousands, if not millions of people. All you have to do is look at the newspaper, listen to television, you'll see there are other countries not so fortunate to have vaccines. You'll get some idea of the degree of suffering we're not experiencing. So I don't think there's any misinformation floating here. I think it's a matter of paying attention to what's going on in reality. And as far as what constitutes an outbreak, the definition for an outbreak has more to do with the fact of how well the issue really is, how contagious is the agent and how dangerous is it? And I want you to know that other than measles and smallpox, the COVID virus is a leader in killing, sickness, and illness, and death. So make no mistake about it. This is a formidable enemy that has no regard for barriers or philosophy or ideology.
And correct me if I'm wrong, Mike, this is not just our recommendation. This is the CDC's recommendation.
Correct. Yes, this is, yes.
It's not just Littleton's Board of Health's recommendation.
Yes.
So.
And I also like to point out that the federal government has already indicated that for federal contractors, people who are being employed under federal contractor basis, as well as employees, must get vaccinated or have to be tested every day to keep their jobs. That's a serious requirement. It gives you an idea of how important it is.
Great. Did anybody else have any comments at all?
There are no other hands raised.
Okay. Anybody else have any questions or comments regarding the COVID update discussion with Katrina? Members? No. All right. Thanks so much again, Katrina. So FYI, Katrina's going to meet with us once a month, and she's meeting with school committee once a month. And then there is a COVID working group that we meet supposedly on Mondays or Tuesdays. So she'll be giving us, Jim will be with us every other, well, I don't know if it's going to be every other week, but Jim will be here or Katrina will be here at each of our meetings. So she's been volunteering her time as an unelected person doing all this extra work, just so the kindness and the goodness of her heart. So, all right. Thanks, Katrina. So I know we're a little bit delayed, but we have 7:25, so I'm sorry we're late, of a discussion regarding town meeting protocols for the special town meeting next Monday relating to the mask mandate. And Joe and Anthony were supposed to be here. I know Joe's here.
I don't see Anthony in the audience.
Just going to be you, Joe?
Yes. But also could you, and maybe if Tim Goddard, town moderator, wanted to raise his hand if he wanted to join as a panelist, want to talk with the Board of Health about some protocols for special town meeting. So
Oh,
did
was
let
that Joe
Tim know
and
that we
Son?
would be meeting.
Goddard. Tim Goddard.
Yeah, I'm not seeing him. Can you raise your hand?
Is
if
at the very bottom of the list on my computer.
Ugh. Oh, let's see. Sorry, long list tonight. Here you are. Okay, he's on his way in.
Okay. Well, I'll get started. So hopefully everyone in the mail got their special town meeting report. We're holding a special town meeting at the Littleton High School on Monday, October 25th, 7 p.m. Knowing that this is a public facility, masks are going to be required to be worn as well. But one of the things that we just wanted to discuss with the board was protocols as far as speakers and also for people such as Tim, who primarily most of what they do at town meeting is speak or control town meeting. One of the things in talking to Anthony and some of the staff was that, similar protocols as far as public buildings where people in their seats, we're going to be asking that they remain masked. For people that are then going to be speaking at a microphone, we'll make sure that there's lines that make sure that people can sort of stay a respectful distance from those that are maybe also lined up at the microphone to speak. And that our thought is that when someone wants to speak to town meeting at the microphone, that they basically take their mask off to speak. Once they're done, put their mask back on before they proceed back to their seat. We all know, the difficulty sometimes in person. It can be to speak through masks and concern through a larger building with a microphone that people may not be able to hear clearly. And then also on sort of the stage, or at least where the select board members, town moderator, town council, myself, finance committee, and associated staff, we would all remain masked. And, similarly, Tim, when he's speaking, would not be wearing a mask while he's speaking, so that people at town meeting can hear him as well. Those were sort of pretty much the steps that we were thinking that were just going to be necessary, but wanted to make sure that we had an opportunity to come before the Board of Health for any additional comments or concerns, or if there's anything else as we're planning to undertake special town meeting, that we can take that into consideration.
Anybody have comments? I know my comment would keep wearing that mask even when you're speaking. I think with the microphone, that's going to aid your ability to be heard. So, and one of the other things I was just thinking is maybe putting some X's on the floor at the microphones to keep people from bunching up. So go ahead, Mike. You had a question. You had a comment.
Joe, and I wish you best of luck with this one. This is not easy. I have a. This is the reason I'm asking this question is because I want to make sure our best defense is out there. Do you have any sense at all of let's put it this way, are the major principals, let's start with the major principals participating, that would be the select board, and whoever else you have up there, and the staff, and the professional staff, their assistants, whoever up on the, as it were, the stage and the podium. Do you have any sense at all of the vaccination rate among that group?
Quite honestly, do not know. I mean, it's my knowledge that all the staff that is in town hall, at least when I say staff, I'm talking about myself, town administrator, finance director, and people. I know we're vaccinated. I believe the board is as well. I don't know about finance committee. So on that part, we haven't done any sort of survey of those. That would be up there, namely finance committee, town moderator, and select board members. We haven't done an official survey as far as who's vaccinated and who isn't.
Okay, I'm not suggesting that you should go out there with guns blazing and, have everyone except the people in the audience vaccinated. That you could do that, I guess, but I'm not suggesting you go out there. It'll give you a better assessment of what your risks are. That's what I'm getting at. The other issue, of course, is the masking. I was wondering, do you plan on having at the entryway two things: the offering of a mask for those residents who decide in their infinite wisdom they forgot it on showing up, and number two, making sure those masks are properly, I know it sounds very old-fashioned, but properly used, because you could put on a very good surgical mask, and I'm sure Dan probably can weigh on this more than I could. You put on a surgical mask and you can make sure if you do it right, it'll work. It'll work. So is there any plan at all to have a brief instruction period where adjust your mask before you come in and that kind of wonderful stuff?
As far as masks, it is our intention of having boxes of masks there for people that do show up without one. When we go through, we're going to be filming our pre-town meeting primer tomorrow, and I'll make sure that we work with LCTV to make sure that we also have at least some sort of statement saying that people are going to have to wear masks. And that it is a public building, and remind them of the mask mandate. As people check in, it would be our intention to leave boxes of masks with the people that are checking in, or at least as people are coming in, making sure there's an opportunity for people to grab one if they don't have one. As far as ensuring proper fit, I'd quite honestly be open to recommendations of the board of health as far as what would be some potential options as far as dealing with that.
The CDC has diagrams, pictures. I'm sorry. The CDC has diagrams and pictures of the proper use of these masks. I mean, it's not that complicated.
Yeah.
In other words, cover your nose, make sure you have the thing pressed down over your nose, flush against your face. I mean, this sounds, old-fashioned stuff, but it makes a difference, especially if you're going to be in the room for an hour or more.
Yeah, and one of the things we can do is because we are inside, because we're going to be using projectors, we could have essentially a pre-roll for people walking in. And the graphic that Katrina had, or we can try to find something that would make reference to, please adjust your mask. He is proper fitting. So I think there would be the opportunity to try to have something on the screen as people walk in, making sure that we can remind people of that.
Do you plan on having 6-foot spacing?
We're going to be going through, I know that the town clerk and sort of laying things out was going to be having 6-foot spacing, but then allowing some options when like for 2 seats to go together as well, a husband and wife, or people from the same household going together so that they can sit together rather than having them also 6 feet apart. One of the reasons why we chose the high school was also that there was larger overflow space, so that as we separate people that then we can more easily take advantage of overflow space that would not be as available at the middle school.
Thanks.
It will be broadcast live on LCTV as well. So if people wanted to watch, but not saying no one should go to town meeting, but if people wanted to at least see the proceedings, they can see on LCTV.
But they can't. But they can't participate remotely. Correct.
Correct. Correct.
Still in the 20th century, right?
Unless we want to change our form of government and go to representative, right now that's the only thing that's allowed.
Mm-hmm.
So I'm still saying that you would want the speakers, Tim and anybody coming up to the microphone, to continue to wear their mask, not lower it, because that microphone is going to get pretty nasty with people speaking on it. So, Dan or Kevin, did you guys have any questions or comments? Go ahead, Dan.
I was going to say, so I had two things. One, I agree that our microphones are pretty good, that for most people, the microphone, having a mask or not, is not going to make a significant difference as far as their ability to be understood. As far as Tim as moderator, certainly I understand speaking in front of a large group for a long time gets old with a mask. However, I see two things. One, at the dais, speaking that big group, I wouldn't even consider not having him have a mask unless he had a medical reason not to, without a very large space between him and anyone else. But I think the message of having the town moderator in an enclosed space without a mask is not the message that we want to be sending to our community when we have 36 official cases right now, an anticipated 49 tomorrow, and 17 cases in the schools in the last 9 days. I do not think we want to see a town official standing in front of the community without a mask, without a really good reason. And speaking into a microphone, for me, is not a good enough reason personally. As far as the audience, I agree that we know that hard surface vectors aren't significant for corona right now. However, having a microphone, which is inches from a face, that if we do in fact have someone who is positive and asymptomatic, or positive and is symptomatic, but really felt the desire to be at town meeting, every time somebody touches that mic to adjust it, it's on their hands, which means it's going to be on their face before they make it back to their seat. It's just the nature of people. And unless we're wiping down that microphone between every person, I think we are creating the opportunity for a super spreader event at our high school and in our community. And looking at the demographic that we often see at our town meetings at a particularly vulnerable population, which concerns me. As we look at our vaccination rates, one of the biggest gaps is that 50 to 64, which is probably one of our biggest groups that would be attending town meeting. Just historically, that's the folks who are most in tune to our local government and can be there for an evening town meeting. I would say unless there's a really specific reason, someone who can't be understood, or if we have a medical necessity, I don't see any reason why we should be pulling back on masks, particularly having just watched 15 minutes ago Katrina's messaging on where we are today and where we're going to expect to be tomorrow's DPH report. I'm not sure this is the message we'd want to send just for, truthfully, convenience.
Okay. No, thanks for the input. And also we can make sure that we look at opportunities for wiping down the microphone in between speakers as well. Have wipes and way for people to do that. So thank you for that feedback.
Does anybody want to read Jim's comments, or does Kevin or Gino, you have any questions or comments for Joe before we read Jim's comments?
Nope, I agree with you.
I'll be happy to be Jim again.
Okay.
Unless you'd like to, Lisa. Would you like to be Jim?
Let Kevin be Jim.
Oh, let Kevin be Jim. Be Jim.
You have him? Do you have him in front of you, Kevin?
Yeah, I do. Okay. Town meeting. I briefly spoke with Joe Layden about the town meeting and provided my usual list of considerations for conducting the meeting: masking per CDC recommendations and your regulations, distancing. How can How can the meeting place be set up to provide and encourage distancing? Ventilations, increase airflow in the building, opening windows, doors, adjusting building ventilation system, etc. And messaging to the public who may attend the meeting to check for symptoms, stay home if they or anyone in their household is sick, bring a mask, and remember social distancing.
Right.
That was it.
That's it.
Great. Okay,
Okay.
great. Yes, I have my booklet right here, Joe, right here.
So at least on a number of those things, we can also, like I said, we can reiterate that as part of our pre-town meeting video that goes out to at least reference exactly what Jim and all of you said. And, I know that we are planning on having the doors open, increase as much airflow as possible to get in, and that we are going to be doing spacing so that we can make sure that people are not on top of each other and that we are taking precautions.
That's good.
In regards to wiping down the microphone, maybe alternating the microphone so that the disinfectant will have a chance to work. So in between each comment, each one, if you can, I know it's hard because everybody tends to line up, but maybe alternate the microphone.
Okay, well, we'll look at that. Originally, because of trying to maintain distances and people lining up, they were trying to have just one microphone off the side so that we weren't creating aisles with people lined up. But we'll look to see what opportunities there would be for doing that.
Okay. Did Tim have any questions or comments at all?
Everything's fine. Thank you.
Yeah, no, I appreciate the opportunity to hear from the Board of Health and get your guidance on this, and we will abide by that guidance. And we do, thank you for hearing us tonight on that issue.
Thanks, Tim. Thanks for what you're doing. All right. So without any more hands raised or anything, any more discussion on this, Janet?
Nope, no public hands raised.
Okay. We're gonna do a little discussion on the sector-specific standards for the mask mandate and requests for variances. There was one gentleman in particular that owned a gym that was a little disappointed that we hadn't talked a little bit more about allowing him to get a variance for the mask mandate. So I downloaded some stuff that Jim had sent about sector specific, and there would be a checklist or something that they would have to figure out. But does anybody have any questions? If they can just, I don't know. Where do we go from here? This is new for me. So requesting variances for the mask mandates. So does anybody have any comments or concerns? Or go ahead, Mike.
Thank you, Madam Chair. I think we could start looking to the future, because we're going to be living with this virus even after we drop down, hopefully soon, from 49 or whatever, and Middlesex cools off and we don't see as many cases, but COVID will still be around with or without mask mandates. So I think we ought to basically sort of lay the groundwork for that future. And I believe the variance has a chance to do it. My suggestion is that I'm afraid that given the fact our effort here for the mask mandate is to prevent transmission. And any time that we, shall we say, at least from a practical point of view, change or allow an opening for eliminating the mask, we have to make sure that the mitigation efforts at that location actually work. That is, don't, shall we say, permit unintended consequences. And it doesn't just involve one place, it involves a number of places. Just because one sector, let's say gyms, places where people try to maintain their health, exercise, whatever, we open that up. That presents certain kinds of challenges, very different, let's say, from movie theaters and other kinds of venues where the public gathers. So I'd like to make the following suggestion. This is strictly voluntary on the part of sector representatives. I think that we ought to consider having basically a real discussion with gym owners, as well as this particular gym owner, to see whether or not they are interested in, shall we say, test running, setting up a test regime. Basically give an opportunity to see if logistically certain things can be accomplished. For example, just an example, that the advantage about gyms is, of course, most gyms have some mechanism of making sure that only members get into the facility. Some are unattended, some are attended. I think you know where I'm heading. What kind of, shall we say, onus would fall on a gym owner or a gym operation if they were asked basically to check all incoming people for whether they were vaccinated or not? This is a private organ. This is private. It's not town, or it's just basically want to come in the gym. We want to make sure you're vaccinated. Then the question is it operational? Will masks give us any particular advantage in that setting? What happens with people who come in from out of town? Basically, let's say Chelmsford, who have a membership in that particular club in Littleton. Do they have to be vaccinated? All those kind of questions, it just, shall we say, sets the ground for a practical way to implement a variance. To ask people to spend money on ventilation and all the rest without knowing the framework within they're operating, they have to understand that. And at the moment, we have no idea what that translates to. So my suggestion is that we start off modestly with organizations and establishments that have already, as customary, check in their public members. In other words, they have to pass some sort of, shall we say, check-in process.
Right. The check-in process that they were using is also a great way for the
Contact tracing, yeah.
Contact tracing, yeah.
Yeah.
So they have limited membership. It's not 24 hours. You come in and work out whenever you want. There's set times for exercise. There's sign-ins. There's, they know who's there when they're there, and there's nobody just comes in off the street to work out there. They have specific classes and times. So
and
limited occupancy, but not not on our part. There's just stations that they work at. So.
Yeah, and the other piece of it, of course, and this is the part that's that's logistically and perhaps even more challenging, and that's testing. Because in order to make any of these, as it were, variances work, really, or even do these pilot analysis to see whether or not we can even do it, we would have to have some form of testing to back us up. So that's you can see the list of what we have to discuss with something as beneficial as a gym. All right. And now I did take the time to talk to some other folks in other towns and other cities about how they're doing this. And in general, movie theaters have no difficulty at all, for example, in checking for evidence of vaccination. And yet they still require masking inside the building, because other than, eating the drinks and whatever have you as they're sitting in the chairs, there's still distancing and all the rest. And so it's easy for them. So that's a different conversation that I think should be happening with people who are actually on the ground and operating these establishments, rather than just us going on and on about, what they have to do or not do. That's just my approach would be incremental, and we're not going to issue any variances. What we're going to do is run what I'm going to call pilot site exercises to work out how to do it best. Because I think whatever we come up with may be useful in a much longer run. Not just for now, but for a longer run.
That makes sense.
So, what would you guys suggest? Meeting with this specific person or having a separate meeting?
What documentation did Jim provide you with, Lisa?
These are fitness centers and health clubs. I can forward it to you guys. Fitness centers and health clubs are defined as any fitness center that provides, and then there's a checklist with, install visual markers for boundaries, establish directional pathways. It's the sector-specific reopening, and there was a date. It was like the latest date. I can forward it to you, guys, if you'd like. And
just keep in mind, just keep in mind, we have now effective vaccines, number one, which we didn't have then.
Right.
And number two, we do have access, although it could be far, far greater, to testing.
Mm-hmm.
And if nothing else, we could, this puts up a demand for testing.
Mm-hmm.
So, the sector specific, comes out of a particular framework, a particular time, a set of circumstances. I'm not sure these are the same. I don't know. I'm not.
Probably not. They're probably a little older. But maybe we could take a look at them, do a markup, maybe chat with Justin. Maybe we can invite him to our next meeting, unless we want to get in touch with him sooner to see if something like a proof of vaccination for entry in conjunction with some testing. I don't know. What do you guys think?
That's a good idea.
I would not have go ahead, Dan.
I guess my only concern is certainly we are looking at, vaccines started, the earliest was last December. Looking at our case rates, we are the highest we've had since, or at least anticipated tomorrow, since January 9th, which would have been pre-vaccinations. So even with our 75% per capita vaccination rate, our active case rate here in town right now is the same as it was just pre-vaccinations. We know there are breakthrough cases. We know, yes, not anywhere near as often as unvaccinated. We know that vaccinated folks can spread, not as much as unvaccinated folks, but it is happening. Our hospitalization rates, we look at, we're 550 hospitalized, almost 200 of those are fully vaccinated, and yet they're hospitalized. So I guess I'm trying to figure simply, I'm concerned. I feel for all of our businesses, and I'm not trying to minimize that. I just want to make sure we're just going to say, oh, you're vaccinated, you're done. That really goes in the face of everything that we've looked at as far as trying to build the layers of mitigation to keep our cases down. Right now, the only active mitigation structure that we have in town, beyond vaccinations, and I'm not minimizing that, is masking. We've gotten rid of capacity limits, we've gotten rid of distancing, it's recommendations, but truthfully, there's very little distancing going on for the public in general in town. That there's our only mitigation beyond vaccination is masking. And as we're finding right now, that masking is not adequate to keep our cases down. I agree that the guidance from DPH for sector specific was pre-vaccination, but I certainly think that should be our starting point and not, I agree it's a different time, but the guidance is probably the best, most objective measures that we're going to be able to come up with. We are not going to redesign occupational health, safety, and ventilation regulations out of the 5 of us plus our support staff. Jim and Janet, I don't think they're going to really want to try to write new regulation looking at air exchange rates per cubic feet per beyond our capabilities. The state has already come up with something. Is it perfect? I don't know. Again, I'm not an occupational engineer. But I think simply making it vaccinated versus not might be too far the other way. I want to support them the best we can. I agree that, for some of the businesses, particularly the business that we're talking about, I agree there are probably mechanisms that we could do to mitigate in that specific situation only because of the unique situation. I just want to make sure that we are thoughtful about it, that we follow some objective measure rather than simply, yeah, you're vaccinated, you're good. But that's not the message we want to send. And as we've seen, that's probably not going to be effective. And I would hate for that population, for that business, that owner to have something happen, or for us to have something happen and go, you know what, we probably should have been at least a little bit more thoughtful in our actions. Perhaps Jim or Janet can share those recommendations, the sector specific from lockdown days, and see what's doable for that business owner or for any of the business owners in that same place, for their sectors. Are these things that can be done in their businesses that, you know, is it doable? Is it financially logical for their business? Can they do it? And then let's work from there. I'm just trying to make sure that we're objective and thoughtful about what we're doing. I just don't want, again, right now, if we were down to 2 or 3 cases, I'm going, we can be brave. I'm not feeling brave right now with where we are.
Yep. All right, so I will forward, well, I think Jim sent it to you and I on October 6th, the link to the standards. There's a lot there and a lot of different settings. It's not just gyms, there's car washes, I think, on there too. So, and golf simulating places. So you have to scroll through there to find gyms and health clubs. But let's keep the, I'm sorry if Justin's still on here. It's just not as easy to, like Dan said, and everybody said, our numbers are going up. It's just not easy to just say, okay, no. So I do want to keep on working with them and seeing what we can do. So I can probably contact him this week and send him those sector specific openings and see if he can accomplish those, and then maybe see what we can do. Okay. Does that sound okay to everybody? Okay. All right. So on to administrative matters. The Littleton Holiday Bazaar, I think we had talked to Nancy Morrison. Janet, I think you got in touch with her, that they need to wear masks and that they should post signs. Provide masks maybe for people that don't have them.
Yeah.
Where is that going to be actually at? Is that at the middle school?
Russell Street, I believe.
Russell Street? It doesn't say in the correspondence where it's going to be.
Yeah, that's the one thing that's missing from that communication. I have no idea where it's going to be held. And I generally know where it's going to be held, but she left that out of the note. Yeah. And the second thing is that if you've ever been to those are very popular with kids, with families, and the residence time inside that place are, I don't know if Dan or Kevin, I know Gino's been there for years, has been there for years. I do know that people behind the, the counters are there for the entire afternoon. So to me, this is sort of, frankly, the town meeting on steroids. So I'm not very, at this point, what is the date for this event?
That's not included in the email either.
Yeah, I think at the moment we've got to put a hold on that, in my view, until we get a lot more information and feedback from them about, have they given real thought to what's going on here? Because I'm sorry.
No, it's just I'm not involved actively, although some of my youth are going to be involved. What we've heard is at Russell Street, it sounds like they're spreading it out a lot bigger than it has been in the past when it was the middle school. It sounds like it's going to be in the gym, the cafeteria, the front walkway under the breezeway kind of cover roof area, and they're also talking about a tent out in the circle by the flagpole in front of the main entrance. So it sounds like they've actually been relatively thoughtful about trying to spread things out as much as possible compared to the gym at the middle school, which is snug on around 11 o'clock on that morning. So again, I would love to hear more from them as well, but it does sound like, from what I've heard so far, that they are trying to spread things out. Santa, it sounds like he's going to be outside. So it sounds like they are working on it, but I agree we could use more direct information from the organizers.
Right. We need a more complete picture in detail. Yep.
So Janet, can you reply to Nancy and see if she can come? We need a date and see if she can come to our next meeting on the 27th.
December 4th is the date.
Okay. Just to make sure that we can give them some recommendations and some guidance on that. All right. There was also a correspondence from Peter Jeffries, a bishop at the Latter-day Saints Church. Wanted to ask about clarification on fining people for not wearing masks. I think it's his responsibility, right? The people won't be fined, but he might be, or he'll get.
Yeah, the establishment's the one who gets fined.
Yeah.
So if he wants to pass that along to folks, that's his prerogative.
Yeah. So should I call him, or should we just email him saying that it's his responsibility?
I believe Jim did speak with him.
Okay.
But I can follow up and double check that.
Awesome. Thank you. Then there was another correspondence from Kathy Romer about the mask mandate. And then Kevin Kaiser. I don't have, was that a voicemail?
Yeah, that was a voicemail.
Okay. And that's the one he was looking for information. So directed him to the town website. I think you said that you already did that, Janet. And FYI, Janet told me, and she told all of us today, but we'll say this on the meeting, that Jim's information is incorporated into the Board of Health website. So numbers, Janet, I assume numbers will be changed weekly when somebody gets that.
I'll change them every week, and when I get them updated from Jim, we have 3 weeks or 3 2-week reports because they overlap, but the last 3 2-week reports listed there. So I will each week I'll remove whatever the oldest one is and add the next 2 weeks so that you can see sort of what the trend is rather than just the existing week.
So I know in our COVID working group, we were talking about maybe copying another town's dashboard. So this is actually kind of our local.
So we have that, we have something similar to that
from the DPA
there as well. And then this in addition, because people were having trouble filtering their way through.
So is the dashboard DPH information or information from them, or okay?
Yes. And then
go ahead.
Go ahead.
I'm sorry. Did we skip over Salute Wine Bar?
We did.
I thought we did.
Yep.
I mean, it's whatever. I just noticed it.
I read her email. She seemed to resolve herself to needing to continue to wear the mask mandate, or use the mask, follow the mask mandate.
Good.
And then Kevin was a point out to the website. I have another one that I've talked to, about the mobile gas station and people not wearing masks. And I think Jim is going to talk to them again. So, and then Woodshed, we'll contact Justin sometime this week and see what we can work through. So, anybody else have any correspondence other than that? Okay. So we'll move on to member comments.
I just like to thank the people of Littleton who've worked very, very hard to continue with masking, keeping the distance. The times I've had to go up a couple of times to the point on a couple of errands. I have to say that Market Basket Management and their staff have been very, at least the number of times I've been up there during the day, during the rush hours, I guess. Compliance on the part of the patrons has been very high. it's maybe one or maybe at the most 5 out of a couple of hundred or 100. And the staff is doing a great job, and they do make their announcements. So they're a very good example. And as far as the movie theater is concerned, I noticed that when the James Bond movie showed up, I got curious and went up there a couple of times just to see how Craig was doing. And there was a steady stream of mask wearers coming in. So, I guess people are paying attention, and and by the way, the movie theater was well posted, and the people were well spaced inside the theater itself. I didn't get to see the movie yet. It's too dangerous for me to go out, of course. So I'm teasing it. So as far as I just want to thank those members of the business establishment here in town who worked very hard to comply with the mask mandate. Please continue. You're protecting the family, you're protecting the kids. We got to keep the schools open, because the real economic threat to this town, believe it or not, is having to close the schools because the virus has caught up with us. So please keep it up. Keep going. Thanks a lot.
Great. Thanks, Mike. Anybody else would like to make a comment? No. Kevin, did you do that letter?
I have a draft of a letter. I'll send it out tomorrow.
Okay.
So everybody, we can discuss it at our next meeting.
Okay. All right. Dan or Gino, any member comments at all?
Everything is fine. Thank you so much. Everything's going to be okay. No comment from you, Mike.
Yes, I was going to reiterate, Mike, that we have, that the businesses have been great, and we're really working in. We all want us to be successful and make sure everyone is healthy as possible. We get through this. Definitely agree on, school is our weak point. We have a lot of folks who are unvaccinated, and all those kids are going homes, and bring whatever, just like every parent knows, whatever is in the school is in the house within 24 hours. They get sick, we all get sick. So we want to make sure that they stay healthy. We make sure that our kids can stay in school. Absolutely.
Yeah. The only other comment is, and this is just a practical matter, that I hope Littleton residents get in the habit of wearing their masks when they're in other towns at other establishments. Because while you're there, this is not a criticism of any other town. I do know that, for example, there's a mask mandate down in place in Westford. So I do know that we have residents who go there for work and to shop. Please wear your masks there. In the case of Westford, you should and have to, but I don't care if it's Acton, Lexington, Chelmsford, wherever. Please, please, please wear your mask as a Littleton resident and wear it proudly. So, because you're helping Littleton when you're out there. Thanks.
Right, we're not in a bubble. Okay, public comments?
There are no hands raised.
Okay, so we'll move on to the minutes of 8/25/21. Janet, I just also present, Paul Glavy was in that meeting.
All right, I'll add that.
That was the only thing I had to say. And does anybody want to make a I guess at the end, member comments, the joint select board will be on Saturday. Did I say that? Wasn't it on Monday? I think it was,
but originally you had been thinking it would be on Saturday, and then it got postponed.
All right. So that's what the minutes show that, and then we ended up changing it. Okay.
Yes.
So can I get a motion to approve the minute meetings for Wednesday, August 25th?
I'll make a motion to approve the meeting minutes from August 25th.
Thank you, Gino. So we'll do roll call. Kevin Baker.
Kevin Baker, yes.
Gino Fratelloni.
Gino Fratelloni, yes.
Dan Kane.
Dan Kane, yes.
And Mike Zeldin.
Mike Zeldin, yes.
And yes. So the next one is the meeting minutes for Wednesday, September 22nd. I had nothing. Anybody else? You guys all good?
Yeah, I'll make a motion to approve the meeting minutes from September 22nd.
Thank you.
Second,
Thanks, Pino. So we'll do a roll call. Kevin Baker,
Kevin Baker, yes.
Pino Fratelloni,
yes.
Dan Kane,
Dan Kane, yes.
Mike Zeldin,
Mike Zeldin, yes.
and Lisa Flanagan, yes. So those will be posted, correct, tomorrow? Great. So,
When the next meeting is going to be? November what?
That's the next discussion. So October 27th is our next scheduled meeting. And then Janet, should we talk about the Thanksgiving week? So
I did send out an email, but just yes.
okay, so we're looking forward to November, and it's the 2nd and the 4th Wednesday of the month, so that would be the 10th and the 24th, but because the holiday is the 25th, we thought maybe people might be traveling out of town. Hopefully not. Just stay home.
Cooking. They're cooking.
But we thought we would adjust it for the holiday schedule, so November 10th and December 1st and December 15th. So Janet's gonna send out an email just to confirm that those dates are okay.
Yeah. I have a question, and that is, our masking mandate ends at the end of this month, correct?
As of now, yep.
Yep.
So I'm assuming we'll be discussing that at our next meeting on the 27th.
Sure. Put that on the agenda.
Yeah, for sure. That would be right there. And
if we can speak with Anthony and town council to make sure that the language on the agenda is adequate to allow us to take any action as deemed necessary regarding our mandate without having a challenge to it. So whether it's extend it, modify it, or end it, whatever language that needs to be, let's just make sure that we get it squared away.
All the above, right?
Yeah.
Okay. Great.
I'm sorry, Dan, apropos of your comment, I think both you and Kevin probably know very well that the state basically has a masking requirement that they've extended right through the month of October, or does that include November, as far as you know? For schools, Desi.
That expires November 1st as well, I believe.
Okay. So I just want to be clear. So we have no idea what they're going to do or not going to do. And we don't know exactly what our situation is in 2 weeks. So, but we ought to be, shall we say, prepared to discuss the necessity or inclination or need to extend the masking mandate to include the schools as well as the towns, if necessary, et cetera, et cetera. I don't want to get ahead of myself, but I think we ought to be prepared.
Right. So with the town administrator and town council.
Yeah, I mean, it has to be more can we do with the town. The question is, I want to be very careful that we consult with the school committee and with the superintendent and all the rest, because there has to be a consistency between what we do for the town and what happens in the schools. Because very frankly, you know, if the town is going up or the town is holding a steady burn, that affects the schools. It's the community spread being spread into the schools. It's not the other way around. The schools don't spread to us. They are the champions of mitigators.
Right. That's something that we should.
Yep.
Are you proposing a meeting with the school committee prior to our meeting?
I spoke with Matt last night, and I think he and Justin are busy tonight. So they're not going to be able to join us, but I think that is something that they're talking about because, and I'm getting, I don't know if anybody else knows, the last COVID working group meeting was, that I attended was not this week, but the week before. And Lynn Snow said that the vaccination rate was 51%, but Matt Hunt seems to think that it's higher. And I think that they're looking for a way to exit once they reach that percentage. So I think we all need to talk about that. So.
Yeah, the other thing I'm just going to point out is that the 80% marker, another thing, just add to your burden, folks, is the 80% marker is an arbitrary one. There's absolutely nothing about it other than the fact that it's a number. Sounds great. There is no agreement on what number is achieved in vaccination rate that basically brings this virus under control. So that means so-called herd immunity. No one knows what that number is.
Right,
but it doesn't look like 80% is going to be it. Let's put it that way. It's not going to be 80%.
All right. So should we? Would anybody would be interested in doing like a non-quorum meeting with Matt and Justin? Can we do something like that?
Yeah, make arrangement.
Sure.
Well, it would be nice to see if they're thinking it all ahead to see what they have in mind.
I think they're in a different meeting tonight, totally different than COVID. So, all right, I'll reach out to Matt and see if we can do a Zoom or something like that and see what they're thinking. Okay.
And escape from the masking is the least of their the least of their concerns, I guess, at this point. I don't know what they have in mind.
Okay. All right. So we're all set for the 27th, October 27th.
Yes,
And
we are.
motion to adjourn.
Motion to adjourn.
Second.
I second.
All right. We'll do a roll call. Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni.
Yes, and good night. Thank you.
Good night, Gino. Dan Kane.
Dan Kane,
Mike.
yes.
Mike Zeldin.
Mike Selden, yes. And good night, Gino. You've been great tonight. Fantastic.
Oh, thank you for the
Flanagan,
compliment.
yes. All right.
Everybody
adjourned.
did a good job.
Good night, everyone.
Proud of you.
Good
Thank you
night.
all.